I was wondering what string I was going to pull with you because there's so many strings that we could go down, but I got it when you were just speaking because I imagine that remote patient management is going to it's like the 80s revolution in prevention. Remember when it was like so when HMOs came about and then everybody's going toward prevention. This is like a whole new level because things that you couldn't track with Bluetooth monitoring, with remote patient management, things that doctors maybe got the symptoms, however vague or specific, from their doctors once every 3, 6 months to a year when they would come in for a visit. Now they can watch trends
Yep.
and things like that. So I guess my question would be, and then I'm just going to let you rip. Um, what is the future of medicine with AI specifying and increasing the technology and the capability of remote patient management? Where do you see this going?
Oh my gosh. I
That's what
don't
I was
think we've
hoping for.
ever, yeah, I don't think we've ever had anything so powerful and how it's evolving as like that remote patient monitoring or management plus AI. The only issue, Karen, that I see is the reimbursement for these codes are not really high and very, very stringent. So Medicare or other health insurance will only pay for remote patient you could say management. Now I'm saying remote patient monitoring.
Monitoring. I'm sorry. I was saying
Monitoring,
same.
that's fine. It is management too,
Yeah.
but only if it's physiological things. So like blood pressure, blood sugar, weight, respiration. So for example, you can't really like sleep unless it's a sleep apnea machine, but it's hard. And stress level, no. So just physiological things. And you have to have so many readings per 30-day cycle in order for that doctor to bill for it. So it's widely used. However, difficult to get paid, not a lot of money in it, and you have to have a staff. So usually they outsource to the third party. That's kind of where I shine because I help people, manage the clinical teams. But at the end of the day, the margins are pretty thin. So patients get a lot of benefit from it because they have a nurse calling them. Doctors get very little financial benefit. And now they have this data, like all this data that they have to look through and watch. So not everybody love it. With AI, it's going to be amazing because AI will be able to like summarize, show, and really alert. Right now, the alerts are, hey, your blood pressure is high. But what I'm seeing in the future is hopefully whether or not Medicare is going to cover it, but I think a lot of people are actually going to go and buy them, like the Aura rings
Yeah.
or the Wise is going to have everything. And AI will be right now, AI can actually even sense your voice and sense whether or not you're stressed out.
Yeah, we saw
Or right.
that.
It's
We
it's 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 mind blowing.
yeah, we talked to a
It
guy
can
at the
sense
health
your
conference who had
yeah, like
some tech.
respiration
Yeah.
and think, what's happening. And so people will be able to truly, to me, it's not a prevention because once you already have a symptom, so maybe it's like a tertiary prevention, but at least it's something that quickly can alert you as a person, forget about patient or not, but you as a person, and
Yeah.
actually nurses should really try and wear those rings or watches because it can alert you and say, for example, Karen, I know you have a shift scheduled tomorrow, but this might be the time that you really need to take your
But
time off.
your body battery's at -3.
Right. Because I remember that I had to stop on the shoulder of a very, very like highway in a very bad area to take a nap coming from a night shift when I was a nurse because I was like, it's either that or possibly I'm crashing.
Yeah.
So if I had something and police knocked on my door and she said, oh, we gotta call that there's a dead white woman in the car. And I was like, of course, I got really awake and went home. But if I knew that, I probably would have taken a nap in my car, maybe in the garage and not drive or call. I mean, that was before Uber, right? But call my brother or somebody to pick me
Yeah.
up. So I think it's going to revolutionize healthcare in general.